the Independent Payment Advisory Board represents the very worst of the worst of what will happen. As a physician, as a member of Congress, as a father, as a husband, as a patient in his 60s, I am offended by the Independent Payment Advisory Board. This board is not accountable to any constituency, and it exists only to cut provider payments to fit a mathematically created target. The board throws the government into the middle of what should be a sacred relationship between the doctor and the patient. The doctor and the patient should have the power to influence prices and guide care, not this board. Beyond controlling Medicare, the Independent Payment Advisory Board's rationing edicts will serve as a benchmark for private insurance carriers' own payment changes. That's right. Although Mr. Waxman bemoaned the fact that private insurance would be part of Medicare, this thing will actually dictate the behavior of private insurances in this country. The board will have far-reaching implications beyond Medicare for our nation's doctors. Because of the limitations on what the control board can cut, the majority of spending reductions will come from cuts to Part B, the doctor's fees. Doctors will become increasingly unable to provide the services that the board has decided are not valuable. Is the answer to squeeze out doctors? Sounds like rationing to me. So, which sounds like the better option? Medicare bankruptcy and an unelected board deciding the care of Medicare beneficiaries, or doctors and patients deciding and defending the right of the care that they receive? The future of American health care should not be left up to this board, to this panel. It's an aloof arbiter of health care for seniors who depend on Medicare. I support the repeal of the Independent Payment Advisory Board. I'll just leave you with a quote from the American Medical Association. It puts our health policy and payment decisions in the hands of an independent body with no accountability. Major changes in the Medicare program should be decided by elected officials. For the American Medical Association, I yield.
Time of the gentleman has expired. The gentleman